Welcome to the Creative Impact Podcast. I'm your host, Rachel Caldwell, and I'm so happy you're here. Each episode, I take some time to chat with fellow artists about life, faith, and the impact of the arts. Hey friends, happy February, and welcome to episode 91 of the Creative Impact Podcast. If this is your first time listening in, we're so grateful to have you here and part of the community. If you've been listening for the past several episodes, you may have noticed a loose theme around wellness and just whole living, and today is no exception to that. My conversation today is with Dr. Katherine Millis, who is a physical therapist with a certification in sports and orthopedic manual therapy. I love her passion for helping artistic athletes attain their personal goals. Dr. Millis earned her Bachelors of Science in Kinesiology from Texas A&M University and her Doctorate of Physical Therapy from the University of the Incarnate Word. As I mentioned, she also has her certificate in Sports and Orthopedic Manual Therapy, and she was a fellow with the American Academy of Orthopedic and Manual Physical Therapists. As a dancer herself, Dr. Millis understands the specific needs of dancers and the benefits of working with a PT who understands dance. She's actually still performing professionally today, and she started her own business called Excelerate Physical Therapy. In our conversation today, we talk about her journey as well as what it looked like to start her business in the midst of the pandemic. She also gives some great practical tips for dancers and athletes, and we talk about how really every aspect of our wellness is interrelated. Thank you so much for listening and enjoy my conversation with Dr. Katherine Millis. I'm so excited to be here with Dr. Katherine Millis, and thank you so much for joining me today, Katherine.
Yes, thank you so much for having me. I feel so grateful to be here, and thank you for including me into your podcast.
Yes. And we were talking just a bit ago, but so fun that we got connected through, you're saying through Dulles, which is true because I think like somehow you and Kayla got connected up and you came in and did like a cool masterclass and worked with our students. So that was so fun.
Yeah, that was such a fun experience. And after COVID had happened and we're all trying to get integrated back into normal life, right?
Right.
To be with a group of dancers and dance educators and just be able to start to mesh back into, I guess, normalcy and community. And so it was really fun to be able to do that. So that was a really good time.
For sure. And then another thing that was really fun, actually, it's now coming to me, was seeing you at TDEA, just recently in January and getting to reconnect. And then that kind of spurring this on and being like, I should totally have you on the podcast. So fun that we got to be there both as exhibitors this year. That was so fun.
Yes, I think TDA is such an awesome opportunity to connect. And I think it's so awesome that we were able to meet each other that way. And your booth was super cute, by the way.
Thank you.
Yeah, I just love what you do. And I think it was just exciting to be able to meet there and, try our best to spread our knowledge to the dance world and connect with others.
Exactly. And y'all's booth was super cool as well because I walked over and y'all were doing actual, was it assessments for the educators? Which was super cool.
Yeah, we were doing mini treats. So they would register online and then they would tell us what their problems were or their concerns. That way I was mentally prepared before they would come and then we chat a little and then we do a little mini treatment.
That's so cool. I was like, what? This is amazing. Had the table there and everything. And anyway, speaking of, we kind of got into it a little bit, but do you want to share just a little bit about who you are and what you do? And then we'll dive into your story.
Sure. So hi, everyone. I am Dr. Katherine Millis. I am a physical therapist and I specialize in dancer rehab and recovery. And I spent time after PT school really honing in on dancer wellness. So I got certified in sports and orthopedic manual therapy, and then continued on with my fellowship with the American Academy of Orthopedic Manual Physical Therapists, where I had the opportunity and the privilege to train with people who work with performing artists, work with those high-performing athletes. And so it really helped me prep and prepare to work with dancers like you guys or performing artists. It was really such a cool opportunity, and here we are. So
yes, I love it. And by the way, that's really impressive. Just how smooth you say all of those names of.
It's an alphabet in itself.
It is. I know, so cool though. So I'm curious, I know you have a dance background, which is awesome and that you're still performing. So do you want to just give us a little bit of your kind of dance journey and how you got started in the dance world?
Sure. Yeah. So I started dancing like most of us do at a young age. So I started when I was 2 years old. I grew up in Dallas, Texas, and I started studio company. So ballet, tap, jazz. And then when I was old enough, point, hip hop, all that stuff.
Nice.
Yeah, I loved it. Obviously, I feel like once you fall in love with dance, it's almost impossible to not dance. And so
Right.
yeah, did that through high school, did company in high school with my studio and, sprinkled in with some summer intensives, like at Texas A&M. They have a great summer intensive program, ABT in New York. That was really fun. And once I got to college, I originally was not a Kines major, but maybe we'll talk about that at some point, but spent some time in Missouri training at their school, Missouri Contemporary Ballet, and then changed my life trajectory and moved back to Texas and danced with a company at A&M and Ballet Brazos, where then once I finished all that PT school and education, decided I wanted to go pro cheer circuit and started training for the pro cheer scene, where I auditioned, and even though COVID was kind of in the mix there, was part of Powerhouse Dance Team, which was a semi-pro dance team that performed with, I guess you could say, semi-pro basketball players, but we also had gigs outside of that and just some other gigs here and there throughout the Houston area, and still on that journey today. So I love it, and I'm not quite ready to hang up those dancing shoes. So
Yeah, that's so good. That's so cool. I feel like we had a similar experience probably in high school with doing more like the ballet side and ABT. That would be super fun. I went to the Joffrey Summer Intensive in New York and it was so fun. Yeah, I was like, this is so cool. And, you're actually kind of like living in New York and definitely a special experience for sure. So,
oh, yeah. I mean, I feel like when I got to New York, it was like, it's overwhelming, right? It's such a different lifestyle. So I'm sure Joffrey, that's such a cool program. I wish I had auditioned and at least tried to get into that program. That's so fun. But yeah, the lifestyle is just so different. I mean, the subways, I was coming from Staten Island, so I was taking a train to a ferry to the city.
wow.
Then I would take the subway, then I would walk, and it was like an hour and a half commute. But now when I look back, I'm like, sometimes in Houston, it's an hour and a half drive to get places. So I'm like, I guess it's not that bad.
Exactly. Just a different city, but different mode of transportation,
Right.
but same time.
Yeah.
Yeah, super cool. So when we got to take the dolls to New York in 2020, right before the pandemic hit, that was so fun. And I feel like I was kind of trying to recreate a few of the experiences that I had for them. So that was fun to be able to like pass it on,
It's cool they got that experience too, because they had somebody who they could trust that they're with in a big city. And, a lot of people live out there making their dreams happen. And that's cool. You expose them to that. So that's so cool.
Yeah, for sure. So I'm super interested to hear kind of what you said, like you shifted majors and how you got into kinesiology and physical therapy and kind of what led you to pursue that.
Yeah. So I think when we're in high school, we're still figuring out what we want to do with our lives. You're 18, you've been exposed to so little things in the world, the opportunities out there. But I initially went to University of Missouri in Columbia as a journalism major because I really enjoyed writing. It came naturally to me. I love science, but I was like, you know what? Writing comes very naturally. So I'm going to follow that trajectory. And so I went to University of Missouri for about a year and a half and realized that I like writing, but I really love science. But that wasn't enough to make me transfer. I had an event happen where I had an injury at Missouri Contemporary Ballet where I landed a jump wrong and I really hurt my ankle. And I went to a PT in Columbia and I was like, hey, I have a spring showcase next week. Please help me. And so
Yeah, wow.
yeah. And they were like, well, we can't have you dance. They were like, just tape it up. I'm sorry, you can't dance. It's too injured. Good luck. Have a great summer, and just do these exercises. And I was like, you're not going to try to help me perform. Like looking back now, like I had probably like a grade 2 ankle sprain, which means that like, yes, I definitely had some damage in there. But if I had some proper training, maybe I could have done, maybe not ballet, but maybe some of the jazz aspects or contemporary aspects.
Right.
Being told that I just couldn't do it. I literally went to rehearsal with my foot wrapped and I was like, I'm going to try, and limping around during rehearsal. And I was just like, this is not happening. And I couldn't perform. And it was awful. I felt like I let down my cast members, and everyone was so sweet, but I felt really bad. And I was like, man, like this obviously doesn't just happen to me. Like this happens to a lot of people. And I was like, I took some time to reflect, and I was like, man, I like science. I love to dance. This situation that happened was completely unfortunate and kind of just stirred something up in me to where I was like, I'm going to just change my life and I'm going to pursue this profession. And I decided I'm transferring to Texas A&M and I'm going to be a Kines major. And I took 14 credit hours that summer to get on my prereqs. I stayed one more semester at Mizzou to get a few more. And then, I transferred over, and that's how I got to A&M and started pursuing kinesiology and physical therapy.
That's incredible. So, I mean, it's so neat in a way to see, like, sometimes it's those curveballs that get thrown at us that end up getting us to where we were meant to be, really, or like taking us on that journey. So that's so cool. I love hearing kind of like how people end up finding passion for certain things. So yeah, I'm curious, how do you specialize as a physical therapist for dance specifically?
That's a great question. Yes. So technically through the APTA, or American Physical Therapy Association, which is a big organization where we host different special groups, which is like orthopedics, neuro, geriatric specialties. There actually isn't a unique dance specialty, at least not at this time. And so the best way to become a specialist is to mentor with those who work with those patient populations. So for me, the only way I really could get that training was through my fellowship. In physical therapy school, you go over a lot of topics. They teach you a lot of things so that you can figure out what specialty or patient population you want to work with. And then once you pass your board exams, if you decide to get a certification or do that residency program, you can and hone in on that. For dance, the only way I really could get that was through my fellowship. So the fellowship takes some time to get there. It's a lot of work, I will say. It's not just, going to class and hands-on labs, but it's a lot of research projects. And then you spend tons of hours doing mentorship hours, like tons of hours. And so
Wow.
you spend time with people who do what you want to do. And so that's how I became dance specialist, by working with mentors who understood performing artists, who understood athletes, high performing athletes, so they could help me get in that appropriate mindset to work with dancers.
Yes, that's super cool to know, like just how that works. And, because you never know, someone may be listening that's like, I really would love to pursue that one day. So super cool. And I was actually listening to a podcast recently where they were talking about, it's essentially a similar like physical therapy for artists and performers. And this particular physical therapist, he works with vocal performers and different things like that, sometimes with dancers and other artists as well. But just, he was saying how it is a different mindset, kind of like you were saying with, those physical therapists were like, sorry, you can't perform and here's what you can do for the summer. Whereas he's like, the way I approach it is totally from the mindset of, how can we make this possible, if at all possible, kind of thing. So, because it really is, it's like so much a part of our heart and we don't want to like miss performances. So yeah, I don't know. Is that similar to what you see now when you're working with dancers specifically, like trying to have that mindset to help them be able to perform even when maybe a traditional physical therapist or like more general wouldn't necessarily, think it was possible, I guess. I don't know. I feel like that was very wordy.
I feel like you're asking, like, why should someone potentially work with a PT who understands dance, and how maybe that can change their mindset when it comes to maybe being open-minded and vocal about being injured, or if they're hurting, so that they can take care of their bodies but still perform, I feel like.
Yes, that's perfect because sometimes I could see how as a dancer, you almost don't want to say anything because you don't want to miss out on performing. And so a lot of times people push through or, just work through the pain instead of really actually addressing the issue. So yeah, that's a great way to come about it. Like, why would you recommend dancers specifically working with a PT that understands dance?
Yeah, definitely. So when you have somebody that understands your sport, right, it's already going to make everything way more efficient. I don't have to look up, what a pas de bourrée is or penché. Like you tell me you're doing a specific movement in dance and that's what's hurting. I'm already thinking about the biomechanics of the movement, like what's happening at the hips, what's happening at the legs, what muscles are engaging, where would there potentially be neural tension. So all of these things are already going through a PT's head when they understand what you're doing. When you work with a PT who might be considered more of a generalist, which is great in a lot of settings. But for dance, it really does help to chat with somebody who knows what you're doing. But if you work with a generalist, they may be like, okay, what is that movement? And maybe performing that movement is increasing your symptoms, right? So you don't want to show it. So they're off YouTubing or Googling, trying to figure out like what exactly is going on. And that can just slow down the process when it comes to your recovery. And we want you to recover as quickly and efficiently as possible in a safe way as well, so that you can get back to doing what you love. And so that's why I always encourage, if you have the opportunity to work with a dance PT who truly understands what you're doing, your ability to recover will be I feel like a lot more efficient. Also, too, when you deal with someone who's danced, we understand the culture. We understand, too, that, yeah, you probably have someone breathing down your neck saying, hey, I need you to dance, depending on whether you're professional dancer, collegiate, maybe it's for, end of your exam and you have to be able to perform and you feel the stress of that. Or you're in high school and you have a drill team competition that weekend and you're like, oh my gosh, like I have a hamstring strain. I'm hurting. What do I do? I'm expected to be in this formation. So understanding the pressures in the culture, I think, too, helps them have that mental support as well, to know that you understand. And are you going to help me get there? Or what is the plan? And so I always hate to tell dancers, unless it's absolutely necessary, like can't dance. We always try to see if there is a way to make it happen, but it has to be safe. If not, obviously there are situations where it's not safe and we want your body to be healthy.
Right.
But yes, I think, that dance PT isn't a good edge for you to stay, I guess, at your best potential and have someone in your back corner who really understands what you're doing and help you continue doing what you love.
Yes. I mean, I think that could make a huge difference just in the mental load of it, just having someone that does understand where you're coming from. And I love that you are a dancer. And I'm sure there's probably people who maybe have specialized in it that may not have been a dancer themselves, but are learning a lot about it. But I love that you have that background and are currently dancing. And I'm curious, as you're still performing, how does your, training as a PT and your knowledge kind of influence you as a dancer?
That's such a good question. I tell myself, I'm like, practice what you preach, Catherine. The last gig I had was in October and we were going through that temperature shift and I had to really tell myself, like, you have to warm up. We had long gaps between each show. And so I had to actively warm up with other cast members. Like we had to be good about it. Like warm up, not just like static stretching, like dynamic warm ups, making sure that we're prepared every time before we go on stage. I think a lot of it is just, there's so much knowledge that you learn in these programs and it can be overwhelming because you know everything you're supposed to do. I will say implementing is definitely a challenge.
Yeah, I bet. Yeah.
But I will say that I try to have grace with myself and be like, you know what, you're not perfect, but you can just do the best you can. But I would say like, it does help knowing like, I know what I need to do. I just need to do it. And I think working with my patients and my dancers is a great reinforcer for me to be like, hey, like take care of yourself too, so you can take care of others. So,
ooh, that's super good. Yeah, it's one thing to know it and then another thing to live it out. So that's great that you're finding that and and that it's helpful. And I could see how it would definitely reinforce as you encounter situations and it's like, okay, again, I see the value of what I'm doing. Yeah.
I'm like, it's free,
That's good.
support it. I'm like, just do with the research, what works. But yeah, implementation, I'm sure it's everyone's biggest thing. Just do it, right?
Exactly. So I think it's so cool that you built your own business called Accelerate Physical Therapy. And just first of all, congratulations, because that is a big step, just starting something like that.
Yeah, it definitely was scary. We were in the height of COVID. I knew back in 2019 that I was already wanting to start my own practice, but it's scary to step away from a job that makes you feel secure, right? To do something that you're so passionate about. And I was going to start it that year. and then, or I was like prepping, and I was going to start it like January, February, around then. But then that's when we kind of started having all the COVID scares. I think it started in like March, somewhere around there, February,
Right.
like, oh, what is happening? And, everything was starting to shut down. And so I was like, well, you know what? Like, this is a perfect time to build connections. People aren't as busy. Like, I'm going to make the jump. And so I quit my job and I was like, we're doing this. And so even though it was scary, I had great support from family and friends. And I'm so grateful for that. And my husband was like, hey, if you're passionate for this, like, let's just do it. So did it, and it was great to have that downtime to really just connect with people and build relationships so that when everyone came back, we could jump in. Because really, when everyone came off of that COVID spin and all of that break, we were dealing with a lot of injuries because people weren't taking the time to train back into dance. And so it worked.
Yeah, that's true.
Timing, I always say timing is everything. And even though it was scary during the pandemic, I'm so grateful it happened how it did. And it's been a journey, and I'm so excited to be here and ride the ride.
Exactly. Any specific challenges that stand out just in getting started? Obviously, the pandemic is a challenge, but it sounds like that actually kind of became like a blessing in disguise. But any other challenges that you faced along the way?
I would say, so as a healthcare provider, it's really easy to put yourself on the back burner because you always have this need or desire to make sure those that are your patients or those you care about are taken care of. And I would say one of the biggest challenges is owning your own practice, is taking that me time. It's so easy for me to be like, oh, you need a session this day, this time, let's do it. Like, I want to make sure you're good to go. So taking a step back and being like, no, like, I need this day to rest and recover because I know it'll allow me to do better the next day because I'm able to decompress, take care of myself, maybe get a workout in, hang out with the dog,
Yeah.
just have some me time. And so I would say that's probably a challenge. And then I think another one too that a lot of healthcare providers struggle with is trying not to take the burden or feeling the need. How do I word this? I guess to not feel like you're responsible for how the progress is going, if that makes sense. So
Yes.
if a dancer is injured and you work with them and you want them to get better over a certain time, but understanding too and stepping back, being like, you're only human and you can only achieve so much in a session and that the patient has to do their part as well. I think it's just easy for us to take the burden of their aches and pains. I think it's a good way to say it. But to take the burden of their aches and pains because you want to take that away from them. And when it's taking time, everyone's body is different, that's hard. That's really hard because you don't want to see people in pain. And so I would say that's probably another challenge. And I think that's something most healthcare providers struggle with is just, wanting to help you not hurt anymore, at least in PT.
Yes, that makes sense for sure. And I can even see emotionally that could be a challenge too, because, you're sensing probably, some of the struggle that they're having just in dealing with it. And so I could see how that would be easy to take on, and just kind of be like, okay, this is not mine to necessarily quote fix or like,
Right.
I'm here to help. But yeah, that makes sense.
Yeah, it's like as a guide. I think that was the word I was looking for. Like, we're here to guide you. We're here to apply the knowledge that we have. I'm also really big on, making sure that the dancer, if needed, has other healthcare providers that can guide, whether it is an orthopedic specialist or just their primary care or, a dietitian, registered dietitian or mental health. A lot of times it's never just black and white. There's always gray areas. And, with someone with chronic pain, yes, it's physically felt, but what are your stressors in your life? What is your diet like? All of these things can contribute to that. And so understanding from my point of view, just stepping back and being like, hey, like, this is multifaceted. You're doing the best you can. And they know you're doing your best and, not taking that burden. Like you said, that mental burden, because we just want y'all to feel better.
Yes, exactly. And I love what you said as well about, taking care of ourselves, especially healthcare providers. I can totally see that. But yeah, in general, it's easy probably as entrepreneur as well. If you're a business owner, because it feels like it's never done.
Right.
You could always be doing more.
Oh my gosh. Yes. That is so accurate.
Yes. So kind of having to say, okay, Boundaries are a good thing. It's okay to rest, like it needed to rest and I'm working on that as well. So figuring out the right balance of how much to push and then how much to like create space.
Yes. And because you run your own business and that, yeah, it's hard. Sometimes you go to bed at night like, oh, I could have sent 3 more emails, or I should have followed up with that patient or whatnot. And you're just like, oh, okay, it can wait,
Exactly. So I'm curious, any highlights as well, kind of on the flip side?
Yes, for sure. Okay, so I think my favorite is getting to work with dancers in general. It is such a fun population. I love hearing stories of the dancers. It's not just like helping y'all achieve your goals so that you feel better, but I love getting to watch y'all perform. I think that's like the most fun part. You have a show coming up if I can make it, or any kind of showcase. Like that for me is just the cherry on top, knowing that like you're dancing, you're not having as much pain or no pain anymore, and just enjoying the art form dance. I think that's a huge highlight for me. I absolutely love that, knowing that you are just feeling better. And then I would also say too, after working in a large corporate setting before I started my company, what I really find is a highlight working for myself and for my dancers is being able to dictate the care that they need on their terms. So instead of having like a large corporation telling us as coworkers what we should be doing based on whether it be the accounting side or quota, I can based on their needs. Everyone's unique. And so being like, this is your injury. We anticipate this amount of time for recovery, and we're going to focus on having this many sessions versus like everyone gets 12 sessions over the course of 4 weeks, regardless of your injury, because I have a quota I have to make, which is really sad, but that's a lot of how medical works or insurance works. And so I'm just so grateful to know that. And almost like it's a breath of fresh air to be like, okay, I can really just focus on what do you need and how can we make that happen versus feeling pressured from an external factor. That's a huge plus.
Yeah.
For this, owning the practice. So that's a huge highlight as well.
I could totally see that. Yes. Because, when you're in a large organization, there's definitely those kind of like restrictions and they want it to be maybe easier to process. So there's like certain options or whatever. Yeah. That would be a really, really nice benefit of owning your own practice for sure. Yeah. Anything that's been surprising for you as you've been building this?
Surprising. Let's see. I would say I don't think I anticipated how exciting and fun it would be. I guess I don't think I expected how many shows that I would have the pleasure of going to. I don't think I thought about that side. I think I thought about a lot of I'm doing the medical side, I'm helping people recover, but like I don't think I anticipated how fun it would be to actually see the dancers perform. I think I didn't even really think about that, but now I'm like literally planning shows pretty frequently to go see people perform, and I love it because I'm like I love seeing dancers perform. I mean, it's the best part, performing arts. Like it's just brings all the joy.
Exactly. Yes. Seeing them in their element. Yeah.
Gosh, yes. So I would say that surprised me the most. Like, wow, I've gone to a lot of shows this year, but it's been people that I know and have been able to work with. And it honestly being part of their journey makes me not only grateful that they included me, but like being able to see them perform even stronger and better. It just, health wise better. It makes me, warms the heart. So
yeah. And in a way, this is a cool, I was just realizing this, but a cool way to get to know a very broad range of the dance scene in the city and just, kind of have like a network all over of people and that dance community. So it's already kind of a small world in dance, but I feel like that's awesome that you get to see so many different parts of it,
Yes, it is fun. It's kind of cool being on the medical side because really we're just here to help. And, dance can be stressful. It's competitive, and it's nice to be that we've all been there, right? We've been on that side, like audition, trying to get that one spot, right?
Exactly.
And so being there as just like a support system is really nice because I just want to see you succeed. And I think it's a nice side to be on. So
for sure. So just to kind of glean from your wisdom today, we'll give maybe some free advice to people. I'm just curious, obviously injury prevention is very important for dancers. And I'd love to hear your thoughts on that because sometimes again, we can just kind of go and not really think about what we're doing. But yeah, so maybe the why behind why should we focus on injury prevention, and then also any maybe specific tips that you have for dancers that they can apply, or people that are working out, because that's probably hopefully most of us.
Yeah, I know, right? We're trying out here. Yes. So injury prevention, and I always like to take a step back and say, technically, right, we can't prevent injuries from happening, right? Life happens, and we get sometimes thrown a curveball and we're like, oh man, like, how did I get injured? So I always like to say we can always try our best to reduce the risk of injuries. I like to use injury prevention on social media and things like that because I feel like people are familiar with that and it draws them like, yeah, I don't want to have injuries. And of course, nobody wants to be hurt. But we really want to try to just reduce the risk because we know things in life can just happen.
Right.
So to really reduce that risk of injury, there's really some main facets that can really help you get there. A big one in the dance scene is rest.
Oof. Yeah. That's so hard for dancers.
So hard. And the examples I like to give are like thinking, okay, summer, you have summer break. You actually get to, or at least I'd like to think that a lot of you get to dictate where you get to go, what you're doing. And so I always say, if there's an intensive, you can shorten the amount of weeks of, or take a step back and take a week off and go on a trip with your family or something like that. It really can enhance your performance later because your body has had a chance to recover. At conventions, I was like, do you need to take that jazz class, that hip hop class? Can you take a break? More quantity of dance classes isn't going to guarantee you'll be a better dancer. It's more of quality of how you perform and what you're soaking up based on how your body feels. And so I'm always saying rest, recover is a huge one.
Yes.
Another one would be cross training. Now, I remember my time in high school, I'm sure you do too, how there really just isn't a lot of free time. So that's why there's like none. So trying really to encourage drill team directors, studios to incorporate cross training or strength training, which a lot more are, which is fabulous. But as you get into college, and obviously professionals are so good about it because they understand like this is my body, I have to take care of it. But cross training, so doing anything besides dancing, whether that be just going on a brisk walk, going on a run after you obviously have gotten good shoes and things like that. Don't just go on a spur run, swimming, anything outside of dancing that can strengthen your body. Like usually Pilates is a good start because it's similar to dance and your body is conditioned for it, but it's not dance. And so I always encourage cross training as a form of reducing injury risk. And then the other one is really just being honest and open with yourself. So if you're hurting, talk to somebody you trust, whether it's a dance teacher, a friend, a family member, and then seek medical advice or counsel. Because it might not be anything. We always think the worst, right? Like, I probably broke a bone. Like, no, you probably just like pulled a muscle or something.
Exactly.
But, yeah. So just seeking medical advice, you can get peace of mind. And if there is something that's more pressing, you can get treatment now to help you avoid worsening the symptoms later. Because I guarantee if you have an injury that you put off and you've had it for months and now you're just getting it addressed, you can pretty much guarantee it'll take just as long, if not longer, to recover just because your body is so inflamed and in pain. So yeah, seek medical advice or counsel is a big one as well.
Yeah, that's a good one. And did you present at TDA, I guess maybe last year as well?
Yeah.
Yeah, I feel like I was in your session and I loved you were talking about kind of the difference between like soreness and actual injury pain. And so, yeah, do you want to just share like a little tidbit on the difference and how people can kind of try to evaluate a little bit?
Yeah. So I definitely say and think that as we get older, we become a lot better at body awareness. I find that when I speak with obviously elementary or even some junior high, since they don't usually experience pain on a daily basis because they're young and they don't typically have injuries, their idea of soreness sometimes can be perceived as pain.
Mm-hmm.
So what I usually like to tell dancers and educators is soreness usually, right, dissipates after a couple of days and it should progressively get better. Usually I say 2 to 3 days, it should be feeling better. That's a good sign that you pushed yourself, and you're growing, but you're not injured. But usually with like injuries or pains, aches and pains that require more attention, this pain isn't getting better or it's getting worse over the course of 2 to 3 days. And maybe it's moving location up or down, wherever it is. Maybe the type of sensation of pain is is changing. So instead of just a burning pain, now it's aching, you're getting some numbness, tingling, sharp pain. So I feel like as we get older too, we know our bodies, we know what our normal is. And so we know that wouldn't be normal. So
Right.
just understanding that, like, yeah, that good soreness, that good, sometimes it's achy soreness, it should go away. And after a couple days, and your function as well shouldn't really be impacted. So if you're in a dance class and you had a new choreographer come in and your body was exposed to movements that maybe you weren't as familiar with and you're sore, yes, you might feel a little stiff and whatnot, but you still should be able to execute technique and movements pretty normally. But if you're hurting and you're not sure if it's sore, but your technique is impacted, your execution is impacted, and it's lasting for more than a couple days, that's something that you might want to keep an eye on. A good example I like to give is, say you were known as a turner. You were a really good turner, but you have knee pain now and you're struggling to get on your leg, even straighten the leg, and you keep falling out of your turns. That's not your normal, right? That's something that should get checked. So
That's super helpful. Yeah, I think it's good. And for, dance educators as well to be able to have that knowledge so that they can help their students kind of determine, especially like you said, the younger ones who may not have that awareness quite yet. So they're building it.
yeah.
So I was kind of curious to circle back around to the idea of how, our bodies, kind of the physical, mental, emotional, spiritual, like all these things are interwoven, and we tend to segment in our minds like this is a physical issue. But any other thoughts on just like how interrelated all of these areas of our lives are? Any thoughts on that? Yeah.
Yeah, definitely. So I would say for sure, I mean, over time, I've seen this over the past like decade, like dance and high school and life is just so stressful, especially with now social media, constant comparison, all of these things. We know, and research has shown that, stress really can lower our pain threshold. And so what that means is if we're stressed, we're more vulnerable to experiencing pain and having higher intensities of pain. So what I like to talk to dancers about our evaluations is not just like, okay, XYZ, what do you do with dance? What's hurting, but like, you know, what's going on in your life, not going too detailed, but like how's school going? And we might not talk about that like right at the questions because we want it to be comfortable. But like, what's going on with school? Do you have a lot of tests going on? Everything good with the siblings? Like, just making sure your mental state is good because stress can definitely make an injury feel worse. It just can. Nutrition too. And I know you had the Miss Angie Weiss on here. I love listening to that. That was super helpful. But nutrition,
Yes.
like a lot of dancers I see at the conventions, we're drinking energy drinks, a lot of processed foods. And so we want to be eating foods that reduce inflammation in our body and help our body recover when we're working it so hard. So looking again at that multifaceted, right? Like the mental health, how's our stress, our diet, what are we eating to amplify our body? Obviously the physical we know, and then also like psychological stressors as well, right? Are we dealing with depression, anxiety? And again, those things can also impact how we physically feel. And so I'm a very big advocate on whole body wellness. And so I'm very thankful to know healthcare providers in a lot of these facets. And so if I feel like a dancer needs some TLC in one of those regions, I definitely want to share that information with them.
Yeah, that's so good. And I'm curious, do you have maybe like next 5 years vision for Accelerate and what you're doing?
Yeah. So obviously still want to work with the dance population. Y'all are awesome.
Mhm.
I would love to be able to share this passion with other healthcare providers who want to do dance PT. Definitely would love to be able to bring some other PTs on board who have the same passion and be able to continually spread the knowledge and education to educators, dance programs, things like that. I think the ultimate goal is to be able to just spread awareness and to make it where it becomes more commonplace. Because I still feel like right now, especially where we are, I feel like if you go coast to coast, like maybe California or New York, where it's very heavy, like a dense performing arts population, I feel like they're maybe a little more customized to this injury prevention mindset. But I would love for Houston, Texas, the big cities here to really be able to be more familiarized with, oh yeah, injury prevention or cross training, or yeah, we totally know about that. We integrate that. That's normal. And that's what I would like. I would love that to be more normalized. And that would be a goal. I feel like we're still in the early phases of this idea of body wellness and dance. But I feel like the more of us that are out there spreading this awareness, the more healthy dancers and healthy performers we'll have out there. So
Right.
the long-term goal is that spreading awareness.
Super good. Yes. Thanks for sharing. That's exciting. And it'll be fun to see over the years as it grows. And so one of the questions I love to ask all the guests that come on is there something that you would like to share with other artists right now? Like anything on your heart that you'd like to share?
Well, I guess I would say one of them would be from the PT standpoint is as an artist, no matter what age you are, remembering that your body is your instrument, it's your tool, it's what you use to express yourself outside of your voice. And so please take care of it. You get one body, and I can guarantee that if you take care of it, it will take care of you and what you need. It will perform how you would like it to if you can just take care of it. I would say from a PT standpoint, that would be the main thing that I would want to emphasize.
Love that.
Yeah, it's important. And I think personally for me is just a shout out to, my patients that I work with and those hopefully that I eventually work with that, I'm just so grateful to be a part of their journeys because it is a tough thing to hurt and to bring someone into your life to make yourself vulnerable to recover, to want to recover and open up to somebody. And so love being a part of the journey, love watching them perform. And yeah, it's just something that I really cherish. And so I'd say that's another thing I'd want to share with artists out there. Thank you for letting me part of your journey. And I hope to continue watching you guys thrive.
It's so good. So just for fun, as we wrap up today, I'm curious, what is one of your favorite things right now?
Okay, well, I do love sweets and I love cookies. And I've tried a new diet plan because I wanted to feel less fatigued and everything. And so I've been trying the gluten-free, which has been great. And I found these really great gluten-free cookies and it's the Glutino brand and they look like Oreos and they taste so good. I probably eat more than I should, but they're probably one of my favorite things right now. They're so good and I don't feel foggy brained or anything after I eat them. I usually have them with some almond milk. And I'd say that's probably one of my favorite things right now. And I just love sweets, but
yes, I know. Not I know you, but I know about me. I do too.
It's hard, putting a cap, but those are probably a favorite right now.
Yeah, it's fun to have a little treat now and then. And it's nice when you can find one that's like gluten-free when you're going for gluten-free. So that could be a challenge.
Yeah. Okay.
Well, this has been such a joy and just so much fun to get to connect with you and get to know you better and hear more of your story.
Thank you. Thank you so much.
Yes. Yeah, I would love to let people know where they can connect with you and also with Excelerate PT and just like the best way to do that. So yeah, how can people get in touch?
Yes. So I think a popular way is Instagram at Excelerate, EXCELERATE. PT. On Instagram, you can always DM me. Another option is my email, which is through my Instagram, km@excelmobilept.com. You can also go on our website, excelmobilept.org, where you can put in an inquiry and just check out what we do. And then obviously we have a Facebook as well. So just put in Excelerate PT and you'll find us. But I'd say email or Instagram are great if you want to get a hold of us quicker, if you have any needs or questions. But I would say those are probably the best ways to touch base with us.
Awesome. Well, thank you so much again, Katherine. And I am super grateful to have your expertise and to be able to share that with our friends listening out there. And then also just thank you for, your beautiful spirit. And I just wish you all the best and blessings on your future as you continue to build the business and everything. So
thank you, Rachel. And same to you. I love that you've got your whole business and thank you so much for including me. I appreciate it. It's been fun.
It was so fun connecting with Dr. Millis and hearing her heart behind her practice. If you've been enjoying the show, I encourage you to subscribe wherever you happen to be listening. And if you'd be willing to rate and review the podcast, that would be awesome as it really helps to get the word out about the show. You can find all the links, the full show notes, and additional resources on our website, creativeimpactpodcast.com. If you'd like to learn about supporting the podcast, you can check out our Patreon community. On our website, just go to the link at the top that says Patreon. Thank you so much for listening to the Creative Impact Podcast. The music for the show was produced by Michael Cash. Until next time, remember that you were designed to create and made to inspire. Continue living with purpose and making an impact. I'll see you next time, friends.